Hello there, my name is True and I'm an emergency doctor. During my work, I see patients in many different settings, sometimes in the hospital emergency unit or wards, and sometimes outside the hospital in the community or clinics. Usually, I work as part of a team. One of the big challenges that we have when managing ill and injured patients is recognizing how sick someone is and deciding what care they need first. Another challenge that we deal with every day is working out the best use of our limited resources, both within our own health facilities and for those patients who may need referral across the health system. This was especially true in recent years during our response to the COVID-19 pandemic. When I learned about a course that has been developed by the World Health Organization and the International Committee of the Red Cross called the Basic Emergency Care Course, or BEC for short, I realized that it would help me and all the healthcare workers providing emergency care in my country to overcome some of these challenges. BEC teaches a systematic approach to evaluating and treating patients from the pre-hospital to the in-hospital setting. Because care for the critically ill or injured needs us to work closely in a team of doctors, nurses, and pre-hospital providers, we really want the whole team to be trained the same way so that they can be more efficient and effective. You might be wondering how the BEC course is structured. Well, BEC is structured into 5 modules dealing with common emergency presentations. The first module is the ABCDE approach and teaches a structured approach to any seriously ill patient. The second module is the approach to trauma and teaches a structured approach for when someone is seriously injured. The remaining modules teach about 3 life-threatening presentations, which are difficulty in breathing, shock, and altered mental status. Also included in the course are a guide to the use of common emergency medications, how to perform patient handover and patient transfer. For those of you working in areas with injury related to conflict, there are optional extended modules on blast injuries, penetrating injuries, and burn injuries. In each module, you can expect a combination of clinical theory, practical skills sessions, and simulated case scenarios. This ensures that by the end of the course, BEC providers are able to recognize life-threatening conditions and provide critical interventions to help save lives. A question that is often asked is who should be joining a BEC course. BEC is targeted to first contact healthcare workers and those responsible for providing emergency care, particularly ambulance personnel, nurses, doctors, physician assistants, or clinical officers. BEC focuses on what you can do with limited resources and is useful for healthcare providers with different scopes of clinical practice. In my country, training a few BEC providers made a huge difference. These BEC providers went on to use the knowledge and skills they had learned and also shared this with their colleagues, which improves the quality and efficiency of emergency care delivery in their facilities, with the ultimate goal of saving lives. Imagine if all emergency patients in your setting were seen by providers trained on BEC. It could make a huge difference. If you'd like to learn more about how you can get involved, please send an email to the address provided or visit the link below.